Do you like making decisions for yourself? How about when it comes to your health and well-being? Hello, my name is Stephanie, and I'm sure most of you enjoy a sense of autonomy, and because of that, you should continue listening to this important speech. So today we'll be touching on a touchy subject known as assisted suicide or death with dignity, and we'll go into the history behind it, the laws behind it, why it should be legalized for all Americans. We will go into a short testimony from a patient that followed through with the assisted suicide. And we will end today talking about a few petitions that you can sign. So essentially, assisted suicide is the physician prescribing a lethal dose of a medicine to a terminally ill patient to end their life to avoid suffering. And this came around in the 1990s by a pathologist known as Dr. Jack Kevorkian. And according to an article titled Euthanasia and Assisted Suicide, Dr. Jack Kevorkian ended nearly 132 lives in an 8-year time span. And in that time span, he was arrested multiple times for ending multiple people's lives. However, he was oftenly acquitted. But in 1998, he was arrested again and charged with 8 years in prison for uploading a video of him ending one's life. Now, Dr. Jack Kevorkian was the main starter of assisted suicide. And after that, many states, or a few states actually started legalizing assisted suicide. The first was Oregon in 1997, and then followed by Washington in 2008. Now, many people who do not believe assisted suicide should be legalized believe that it should not be legalized because it may be too easy to access for people with depression and people who do not have terminal illness. However, that's not the case. There are many qualifications that one must meet in order to be deemed eligible for this prescription. So the first one is that you have to be a resident in a state that allows assisted suicide. You have to be at least 18 years old, you have to be mentally competent, and you have to have been diagnosed with a terminal illness that leaves you with only 6 months to live. Now, once you're considered eligible, there's a process that you must go through. The first step is to submit your first oral request, and this usually happens when you are having your end of life discussion with your doctor. Now, if your doctor deems that you are eligible and mentally competent, they will consult with a second physician to confirm your diagnosis and confirm that you're mentally competent. If either of them feel that you are not mentally competent, they will send you for a psych eval. Now, if they both feel that you're mentally competent, you will move on to step 2, which is your second oral request. And that usually happens in 15 days from your first oral request. In that time span, you'll be writing a written request that has to be witnessed by 2 people. And according to an article, How Death with Dignity Laws Work, the author states that Hawaii, Maine, New Jersey, Oregon, and Vermont all require at least 48 hours from that written request to the time the doctor can prescribe that medicine. So that's usually how long you have to wait. Now, once that prescription is filled, it's up to the patient to go get it and take it on their own time. If the patient does not want to take it, they don't have to. And physician-assisted suicide should be legalized for 3 reasons, but the first being that a sense of autonomy. Throughout our whole lives, we are given the choice of what medical interventions we want done. We are given the choice what we want done with our body. Now, if we are allowed to choose how we die, we should be allowed to have a sense of autonomy at our death too. This should be extended to our death. Now, the second and most important reason why it should be legalized is to end one's suffering. So most of the time when a patient is diagnosed with a terminal illness, it comes with a lot of pain, and medicine cannot help that. Therefore, this is the most humane and compassionate way to allow one to end their lives. Now, lastly, it's a safe medical practice. So the doctor can ensure that the patient is ending their life safely. And some patients have stated that if this wasn't a law, they would take their own lives and do it on their own terms. Now, in a YouTube documentary that I watched titled Assisted Suicide, Harriet Scott's Story, Harriet Scott was diagnosed with terminal liver cancer, and she had stated that if the doctors did not allow her to follow through with assisted suicide, she would take it into her own hands. So again, this is a much safer way to allow one to end their own lives. And when it comes to our bodies and our health, we should be the ones to be able to decide what we want to happen. Therefore, all Americans should have access to assisted suicide. And currently, only 9 states have legalized assisted suicides. That is California, Colorado, District of Columbia, Hawaii, Maine, New Jersey, Oregon, Vermont, and Washington. And according to CNN, In California, out of 452 patients who have asked for this prescription, 337 of them have actually followed through with it. So this shows that a lot of the people who want it are actually following through with it. Now, in some cases, people have to move to a different state in order to get this assisted suicide. One of the most famous stories is Brittany Maynard. She was only 29 years old. She was diagnosed with brain cancer, only 6 months left to live, and she had moved to Oregon in order to follow through with assisted suicide. And I'm going to share with you a testimony of hers as to why she followed through with this assisted suicide.
But I most likely won't. So beyond that, having been an only child from my mother, I want her to recover from this and not break down, not suffer from any kind of depression. And my husband.
So Brittany Maynard goes on to talk about her husband and that she wants him to be happy. So essentially she does it because she wants her family to remember her before she was sick. Now, this is understandable, but not every American has this choice to just move in order to get assisted suicide. So you can take this matter into your own hands and help your fellow Americans by signing a few petitions. It only takes a few minutes, and I want to show you how fast it actually is. So all you have to do is search assisted suicide petitions, and many will pop up. All it's going to ask is for your name and your email, and you'll click send, and you have signed a petition. And therefore you can go ahead and do it and help your fellow Americans. Today we discussed assisted suicide. We went over the history and the laws behind it and why it should be legalized. We listened to Brittany Maynard's story. And I challenge you today to go and sign a few petitions and help your fellow Americans. Be the change that you want to see in this world. Thank you for listening.